Hi, good morning everybody. Welcome to Grand Rounds. This morning our short topic speaker will be Dr. Eve Crane. Eve is originally from Los Alamos, New Mexico. Sorry, giving away the top. She earned her BS in chemical engineering from Rice University and then went on to get her MD PhD at the University of Michigan in Ann Arbor. Prior to coming to Hopkins for pathology residency, she also completed a 3-year postdoctoral fellowship at MIT, and then also completed 2 years of urology training at the Lay Clinic in Burlington, Massachusetts. And she is now in her 3rd year of AP-only training.
Good morning. Today I'm going to be talking about cancer, stem cells, and cockroaches. As it turns out that knowledge of the way that colonies are maintained in the insect world is very key for exterminating pests within our homes, and that same knowledge can potentially be applied to cancer therapy, particularly that of multiple myeloma. Now we know that plasma cells are often maligned for their similarity to cockroaches, and indeed, following chemotherapy, often the only thing we'll see within these empty bone marrows are some scattered plasma cells and maybe a few lymphocytes. Similarly, in this abandoned set of row homes here in Baltimore, we see that only cockroaches remain, along with perhaps some scattered rats. Now, oops, now I broke it. Anyway, it's actually very difficult to completely exterminate a roach colony because it's not even really a colony, it's just a collective group with individual females, each capable of giving rise to a large number of eggs that will ultimately, if left behind, be able to regenerate the entire colony very quickly, giving rise to as many as 300,000 offspring, depending on the species, within a single year. By contrast, social insects, such as ants and bees, have a very hierarchical, true colony formation, where the vast majority are worker ants, which are actually all women, that die after only 1 to 3 years, never give rise to any offspring. The males that have one reproductive flight and then die, and then only the queen maintains and can establish a new colony. Now this has important implications for extermination. If it's roaches, you have to exterminate all the roaches. This works best when the infestation is actually just localized, for example, in your kitchen. If it's ants, the infection is nearly never, infestation is nearly never localized, and you have to exploit the hierarchy, not just killing the ants in your kitchen, but then exploit the hierarchy to kill the queen. And finally, we have the most complex situation where you have an insect colony that has multiple queens, in which case you have to find the nest, you have to exterminate them all as if they were roaches, and you have a heterogeneous response to that treatment. Now we actually see all 3 of these insect models within the cancer world. In the roach model, it's actually very closely mirrored by melanoma, where at least 25% of the tumor cells within melanoma, at least in one landmark paper, were tumorigenic. And indeed, melanoma, similar to roaches, is best treated when it is localized. As far as the ant honeybee model, this is what we usually refer to as the cancer stem cell model, has been most established for chronic myelogenous leukemia, which is in fact begins usually within a hematopoietic stem cell itself as a mutation, and only rare cells can function as a cancer stem cell within that population. The bulk of the tumor cells are non-tumorigenic when transplanted. And indeed, CML is also one of the best studied and cancers for targeted cancer therapy. All of the cells carry this BCR-ABL translocation, and you can kill the bulk circulating tumor cells with imatinib. However, even though the cancer stem cells do contain the same mutation, they're actually resistant to the treatment, either due to their proliferation rate or efflux of the cancer drug, and you ultimately get regrowth over long term. So you need something that would specifically target those cells. Now, what about multiple myeloma? These are actually a clonally derived CD138 plasma cell population. We have a variety of cytotoxic drugs that can kill them, similar to roaches, and they will work in vitro, they'll improve patient symptoms, but we get inevitable recurrence. If we look at where normal plasma cells come from, there is actually a normal hierarchy, of course. They're coming from germinal center B cells or memory B cells, and the cells are functionally different than their parent B cells, and they have to extinguish that B cell program in the process of differentiation. Now, what about myeloma cells? Are they actually also subject to this sort of normal hierarchical progression? It turns out in some very elegant work from Drs. Matsui and Rick Jones here at Johns Hopkins They have demonstrated that myeloma is maintained by rare CD138 negative stem cells that are both present within myeloma cell lines as well as in myeloma patients. These cells have a memory B cell phenotype, as we can see here in a histogram that shows them as being CD138 negative. And it turns out these have the same clonal isotype as the tumor, and if you transplant both populations, only that CD138 negative fraction has the ability to go on and regenerate the tumor in mice. Now, additional work in their lab has shown that there are several important implications for exterminating myeloma from this work. For one, you wouldn't necessarily think about it, but you could actually treat myeloma potentially with anti-CD20 or rituximab to wipe out that stem cell within the colony, as well as other potential stem cell pathways they have shown to be active in these cells, and then continue to treat with cytotoxic therapies to wipe out the population. And with that, I acknowledge my mentors in oncology and pathology, Dr. Richard Amby and Dr. Amy Duffield, as well as my sister-in-law, Jessica Jacobanis, who maintains insects at the Albuquerque Zoo, and Eric at EcoCare Pest Management, who advised me on how cockroaches are exterminated. And in fact, his brother John, pictured here, passed away from pancreatic cancer here at Hopkins, and he was keen to help with this project.